is for East Africa, the first one to be held. And thank the symposium organizer, Benjamin Kaposto, our Minister of Health and the partners, the clinical team, academic institutions, patients, and a diverse group, international collaborators whose vision and hard working have made this event possible. Your leadership in convening experts, policymakers, and clinicians, researchers mark a decisive step for our nation's health sector. Today's symposium is more than an academic meeting. It is a national conversation about life-saving science, ethical practice, system strengthening, and compassionate care. Organ transplantation sits at the intersection of cutting-edge medicine, complex logistics, legal and ethical frameworks, and the deep human need. For Tanzania, developing safe, equitable, and sustainable transplant service represent both a moral imperative and an opportunity to advance our health system and clinical education and biomedical research. At UDOM, we recognize three interdependent domains that must advance together if transplantation is to become a realistic, sustainable option for Tanzania. First, capacity building. Transplantation demands a multidisciplinary teams from surgeon to critical care professionals, but also it requires huge infrastructure, care, etc. Building this capacity entails investment in training and in service education. UDOM is ready, and you are already working to partner with our colleagues in and the transplant communication, involvement of community leaders, patient-centered campaign, understanding the trust. To emphasize regional collaboration. This improved therefore will be the measure of our success. Thank you for your dedication to the health of Tanzania. You don't stand ready to collaborate and to educate, to research, and to service in this vital national endeavor. Thank you so much.
Mheshimiwa mgeni rasmi, orodha ilikuwa na wengi, niruhusu wawakilishi kutoka hospitali ya Moi. Wasimamizi wa Orthopedic Institute representative yuko Dr. Mcharo. Naomba niwaambie wawakilishi kutoka hospitali ya Bugando walioko hapa. Naomba niwatambulishe wawakilishi kutoka hospitali ya KMC walioko hapa. Niombe mwakilishi kutoka MCD ambao wasimame. MCD naona hajaingia, tunapisha wale ambao watafika. Mheshimiwa mgeni rasmi, niruhusu sasa nimkaribishe Profesa MAHUBIRI kutoa salamu za hospitali kwa niaba ya hospitali na watumishi wote 1000 ambao wanafanya kazi katika hospitali hii, na pia kwa niaba ya collaborations zote ambazo anazimanage. Makofi tafadhali.
Thank you very much, Dr. Mugisha. Before I proceed, I would also like to introduce to you our guest of honor. This is Dr. Chief Medical Officer. Dr. guest of honor, Chief Medical Officer. Dr. Juliet, representing the Director of Clinical Service, Professor Razak, DVC Academics, Research and Consultants from the University of Dodoma, Dr. Faraja Kiwanga, representing the EE from the National Hospital, Ms. Elina Herman from Buseska, Dr. Thomas Ruta, our regional medical officer, all directors and assistant directors from hospitals and institutions, medical officers, experts in transplant medicine, health policy, health innovation from across Tanzania. I warmly welcome all delegates from national hospitals, regional hospitals, district hospitals, academic institutions, regulatory bodies, development partners, private sector, and our international collaborators. Reflects a shared commitment to advancing honor to invite guests of honor to address us and officially the scientific symposium on the organ transplantation Tanzania open. Tanzania, thank you very much.
Makofi tafadhali. Makofi tena Dr. Grace anapopanda kwenye jukwaa letu kwa ajili ya kutoa neno kwa niaba ya wizara yetu juu ya mkutano wetu. A round of applause once again.
Yeah, can we get seated, please? Please. Professor Abel Makubi, the Executive Director of Benjamin Mkapa Hospital. I just want to acknowledge the presence of Professor Razak, the DVC from University of Dodoma. I'm aware of the presence of Ms. Edna Herman from COSEXA. Is she here? Oh yes, thanks for coming. And Dr. Faraja from MNS institution in the country, our national hospital. But we also have our regional medical officer from Dodoma, Dr. Ruta. I acknowledge all the directors from Benjamin Mkapa, but also other institutions that are present here. Our own teacher, Professor Jul Makani, are you here? She's here. She may revoke my certificate if I don't recognize her. Yeah, so I have to be very careful on that. But I'm also aware of Dr. Magdalena Limo. It's from various parts of this world. You please stand up. In an African culture, once you have a visitor coming outside your territory, you have to recognize them so that next time they come again. So can I ask all of you to stand up? Yeah, I know there are those who are excited to have you, and please feel at home. Please, you may get seated. But let me also acknowledge the presence of the various partners from various institutions, media houses, colleagues and friends. Good morning. It is my pleasure actually to join you today to our very on organ transplant. And I know this symposium has coincided with the 10th anniversary of Benjamin Mkapa. So happiest 10th anniversary Benjamin Mkapa, the ministry. And I understand my colleagues are also here from the ministry. So transplant services in this country are not just hanging in the air, yeah, but they are grounded in the national vision. We have our national vision 2020-50, which is driving, which is providing the strategic direction of this country. And for the sector, or improving accessibility, but also improving affordability. Because you can have all these services, but if they are not accessible, if they are not affordable, then they may not mean anything to the very simple Tanzanian who is somewhere, sitting somewhere there, hoping that the government will bring the services closer to them. But we are also guided by our 5-year development plan, okay, which is coming to an end this year, but I know it is under review, which is really looking at how we can promote human development, specifically in improving the life expectancy of our people, but also reducing morbidity and mortality, as well as building healthcare system that really meets the needs of our people. But we also have our Health Sector Strategic Plan 5, which is now being implemented. And if you look at it, it is actually pinpointed few areas that I would like to share with you. One is to build a workforce, is to improve the healthcare service delivery at all levels. Our healthcare system is structured in such a way that we are providing our services we call it in a pyramid model, whereby the base is where you find the primary healthcare services are, and then as you move up, you go to the tertiary facilities like Benjamin Mkapa and the like. But our Health Sector Strategic Plan 5 also directs us to build a workforce capacity. And one of the areas that we're looking at is super specialized services, including transplant services. And it also directs us to look at how we are going to mobilize resources in terms of supporting these services. As I said, you may have all the services, but if you do not have sustainable way of financing them and making sure that they're accessible to the people, they may not really mean a lot to the people that we are serving. And the other one is strengthening international collaboration. And I think that's why you're here. So you're not here by accident. It's because our Health Sector Strategic Plan 5 directs us to establish meaningful collaborations with international partners and international institutions. And so one of the reasons why we felt that we are very ready to host this conference is because last year, that is 2025, Tanzania enacted its Universal Health Insurance Act. Okay, it was passed by the parliament, and we've now started implementation. And as we may all understand, when you're talking about universal health insurance or coverage in that context, you're trying to address three important things. One is the quality of health services. And two is affordability of the services that you're providing. And three is accessibility. So we thought, as a country, this is the way to go. Yes, we are improving our services, but we must address them in a very holistic approach. And the only way you can achieve that is having the universal health implemented. So with the health insurance, let me take this opportunity once again to really commend and appreciate the political willingness of our government. And in this case, I would really want to mention one person who has really been behind this. And this is none other than our President, Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania. I know in most African countries, when you talk of UHI, it's not an easy agenda, yeah, because it looks at resources, it looks at so many other things. So it wasn't an easy agenda for her to push it forward. I remember we started this back in 2004, I think. We started with Community Health Insurance Fund, and then we had the National Health Insurance Fund, and then we had the private health insurance funds. But that bold decision to make it a national agenda, a national priority, a national agenda that will include everyone, regardless of their socioeconomic status, you know, it was like going back and forth, because everyone would look at it and they'll go back and say, like, where do we get the resources? And I think this is also your experience in your various African countries. But this time around, Her Excellency said, no, we can't keep on pushing this agenda back and forth. We have to take bold steps, bold decisions, and make it a national agenda, and actually look for resources on how we are going to finance the health sector. So I'm very glad to say that this conference is coming very timely when the government of Tanzania is really pushing the universal health insurance agenda forward. And out of the services that will be covered, you know, with this, with the UHI agenda, is some of these super specialized services, including transplant services. As you may all understand, these are services that are very expensive. They are very expensive by its nature because they really need a lot of inputs to be accommodated, you know, ranging from human resources, but commodities, you know, aftercare services, et cetera, et cetera. So without really having a sustainable or a sustainable way of financing them, you may introduce these services, but at the end of the day, you may not be really able to make the services reach the people that are really in need of such services. And so what I want to say that as we expand transplant services in Tanzania, we thought it was very important for us also to plan how we are going to finance them. And as I just said, the Universal Health Insurance Framework is really the architecture within the transplant procedure, and we are sure that by embracing health insurance, we'll be progressively able to, you know, increase accessibility, but also roll out these services in the entire country. Today we are here talking about Benjamin Mkapa, but I know there's so many other national institutions that are in the pipeline to increase the scope of transplant services. You know, not only on bone marrow and renal, but also going all the way to liver transplant, cardiac transplant, and other transplants, as you may all know. So again, I remember when we took this agenda of transplant services to her, the first thing she asked us was, so what is the cost like? You know, when you're standing with the president and she's looking at you and she's asking you, what is the cost like? And you know exactly how expensive it is. And you know, for many politicians, for them, it's not really when you start, but how do you sustain it? Yeah? Because once they go on different platforms and say that, you know, we've started these services, they want continuity. You know, they are not looking at a one-time of event. They're looking for continuity, because that's a big political agenda. Okay, for us technical people, yes, it's a milestone technically, but for them, it's a huge political agenda. So the first thing she asked us was like, so how are you going to sustain this? Because when we faced her, we wanted her to kickstart us. And I'm very proud that for the last 5 years, she's been giving us, actually enough financial support, especially to support the underprivileged communities, okay? So we said we had to give her a plan, okay? So you need to kickstart us, but this is how we are planning to scale up these services. And this is how we are planning to sustain these services. So she was like, okay, I think this is a good investment, okay? But we are also able to share, and I think this is what I want to challenge my colleagues here. When we are training in medical school, we only train on how we should provide our services, our patient first, nothing else. Money is none of your concern. But I think this time around we've been challenged. When you plan for any service, you should also be planning how you're going to finance that service and how you're going to sustain that service. And what benefit is the service that you're introducing going to bring, to the economy of the country. So what we did was actually to convince her, like you see, Madam President, when you support these services, first, the numbers that are going to benefit from the service, because if you only focus on sending them to abroad, the numbers will definitely be fewer because the cost will be high. So the numbers will be increased. But also, this is going to be a motivation to our healthcare professionals in the country, because some of them have did train outside the country. They have all the skills. What they need is a conducive working environment in terms of equipment, etc., etc. So we said this is going to be a motivation to our pool of healthcare professionals. But again, this is going to reduce the spending that the government is undergoing currently in terms of forex, sending these patients outside the country. And whatever saving you're going to do, Madam President, you can direct that saving to other productive sectors, okay? And she was like, okay, so what else? We said, yes, what else is that Tanzania is very strategically positioned in terms of how it can be accessible by other countries. The patients actually will be coming to Tanzania. And remember, Benjamin Mkutano in transplant, but also we have Mloganzila Muhimbili in dental and oral health, okay? But also we have I think again in Mloganzila in cardiac services. So we were like, Madam President, what we are trying to tell you is coming to complement what already exists, okay? The fact that we have identified ourselves as a center of excellence in so many areas, we think by having these services in the country actually will complement what is already happening. And there she was like, yes, you have my support. So I want to tell you that the conference that we are doing today, okay, is actually coming in very timely, because as a country, we've already decided, we've already set our strategic direction in terms of our transplant services. On 16th April this year, our country also hosted the second international conference on the World Federation of Neurosurgical Societies. And I'm very happy that most of the countries that are presented here, they also attended that conference. And we were able to accommodate more than 100 delegates from across the globe. And this actually gave another forum to really share with the international family how Tanzania is really serious on moving forward transplant services, but also how strategically we are positioned in terms of scaling up super specialized services, including transplant. So maybe to share with you very briefly, this journey did not start very long. Okay, so we started in 2017. I think we started with Muhimbili National Hospital, and then in 2018 we came to Benjamin Mkapa. But so far we've been able to transplant, around 146 cases. So within a span of 5-6 years, a lot has been achieved. And this should actually give all our international partners a confidence that as a country, with our institutions, we've decided, okay? And we really want to take this agenda forward. So with your partnership, with your support, I can see Tanzania making huge progress in this area. So as a Minister of Health, okay, we have our strategic priorities in terms of advanced care. One of them is to strengthen infrastructure. So in order to elevate these tertiary facilities to really focus on super specialization, we said no. We have to make sure that, you know, some of those services, especially specialized services, which were being done by them, somehow we have to find a way on how we are going to take them somewhere else, okay? So that these tertiary institutions can focus on super specialization, including transplantation. And this is why, actually, as a country, within a span of like 7 years, we have sub-national hospitals. We call them regional referral hospitals. I'm trying to avoid regional because I know globally it may mean something else. It may translate to something else. So these are sub-national hospitals. So we've strengthened them to make sure that, you know, specialized services can be accommodated at that level to give these tertiary facilities a room now to focus on super specialized services. So that has been done. But the other thing that we've done is to make sure that we build and retain our specialized workforce. As I'm speaking right now, we have created a pool of super specialized professionals in various cadres or in various skills. And we have what we call the Samia Scholarship Award Program, okay? This is a program that was started by Her Excellence, the President of this country, and actually it is being financed by her. So we've taken our specialists in different parts of the world because, you know, we truly acknowledge that there are countries that have made huge advancement than us. So we thought it's very important for us to expose our human resource, you know, to those countries. And we are doing this in what we call a set, because we believe for a transplant to be done successfully, you don't only look at a doctor. You need a competent nurse, you need a transplant, you know, technician, technologist, and all those. So we are now training our professionals in a set, okay? So looking at a specific specialization, you train all those skills that are required for a successful procedure to be done. So that is being done, and it is being funded by the transplant services, as I said, and I wouldn't want to go back to this. The best way we thought as a country is to come up with a universal health insurance fund, but also within that, there's a specific fund that will be allocated for non-communicable diseases, which are now a big issue, not only in Tanzania, but also globally. And that is the funding that will take care of these super specialized services, including the transplant services that we are talking about. But all this, for all this to be successful, definitely you need to factor in research and innovation, but as well as data systems. So this will be, you know, part of it. And that's why universities like UDOM are here, because we acknowledge and recognize their competence in terms of research. But also our National Institute of Medical Research, I think they're also represented here. Are they here? Yes, they are also here. Okay, so we are not only looking at service delivery, but we are looking at service delivery in collaboration with training as well as research and innovation. And the sixth one is partnership. And I would really say that the partnership part of it, that's what has brought us in this conference. So at this point, I truly want to acknowledge our colleagues, the Toku Shukai, but also Apollo from India, the HELP, WHO Afro, and so many other international partners who really did hold our hand, because we needed to start somewhere and we couldn't start on our own, but they were there to hold our hand, and here we are celebrating the little steps that we've achieved. But I think to us, it makes a lot of sense, because at the end of the day, they are human lives that have been changed because of the steps that we started somewhere together, and now we are here. So I talked about non-communicable diseases. This is a global burden. It is not only in Tanzania, but it's worldwide. And I'll just share one thing. I think Professor Makani is here. Sickle cell disease. This is one of the diseases that a few years back, if you had sickle cell, that was equal to a death penalty. That was the meaning. But I'm glad to say that with our international collaborators and people like Professor Julie Makani, we said, no, this has to come to an end. So now bone marrow transplant is being done in this country. And when I look at people like her, I feel very proud of her. I don't know what is going through her mind, where she has taken this program, but through the sickle cell program, we've now embarked on rare diseases, other rare diseases. Actually, sickle cell is also classified as a rare disease, okay, but we have other diseases such as hemophilia, et cetera, et cetera. So now we've also embarked on other rare diseases. I believe the very same baby steps that we took to bring sickle cell to that level, we're going to take the same steps to make sure that, you know, all other diseases are also given the, you know, the priority that they deserve, okay? Because you call a certain disease a rare disease if it has not knocked on your door. But if it has knocked on your door, if it's your child, if it's your beloved one in the family, and they have that disease, and there's nothing you can do, it moves from being rare and it becomes 100%. Because any life lost is 100%. You cannot say that because there are just a handful of them, maybe there are just 5 of them. Those are human beings. Those are lives that you're talking about. So this symposium is just another milestone to showcase that as a government, as a country, we are taking everything seriously, and I'm happy to see you, Professor Julie Makani here. I'm sure in the course of this meeting, you really have to share a lot in terms of what, as a country, we've made, the steps that we've made, but also what is our vision in terms of combating these rare diseases, but also supporting our people that are always facing these challenges in the country. So, what is my message to our international partners who are here physically, but those who are also following us virtually? One thing that I would really ask from all of you is a genuine partnership. I'm here to assure you and to reiterate our commitment as a government. So we are looking at partnership in terms of training our people. We are looking at partnership in terms of sharing the protocols that you have in your various countries. Yeah, I'm not talking about a copy and paste here because we are coming from different contexts, but we understand that you have made huge advancements in your respective countries, and Tanzania cannot start from scratch. By the way, it will just be wastage of resources. If you have a brother or a sister to hold your hand, you start right from there. But we are looking at how you can also support our country to achieve international accreditation. Because you may talk a lot about these services, but if they're not accredited, then they may not serve the purpose that we are looking at. And we are looking at how you're going to hold our hands, but also work alongside us so that we can build something or services that will last long for this generation, but also the generations to come. We are not talking about services that will be a one-time off event. No, yeah, these services have to continue. The people during this, our generation have to benefit, but we are also looking at the future generation. How are they also going to benefit? And we are looking at how we are going to share the best practices. I know that Tanzania has made huge advancement, so we have something to share with you, something that you can also learn from us, but we are also looking at how we can also learn from you. And so my expectations from this symposium, and the good thing, I've worked with all of you. I'll make a follow-up. I don't just stand on the podium and speak and leave. No, I'll make a follow-up. Being a technical person in the ministry, you are my pillars. So it's me and you holding our hands, so I'll make a follow-up. One, I expect that from this symposium, we'll have a clear evidence, evidence-based policy recommendations on the legislative that I just talked about, but regulation as well as operational frameworks, that we need to accelerate the transplant services in this country. Yes, we have started, but if you look at our coverage, it isn't that much big. The needs and what we have, they are not in keeping, okay? So this symposium will tell us, how we can really accelerate our pace. But also a roadmap for human resource development, to support these services, okay, especially the super specialized services that I've been talking about, okay, and how we can support our institutions, our training institutions, and how we can forge meaningful collaborations between our institutions within the country with other institutions outside the country. But also how we can reach consensus, because coming from the government, resources are always scarce. So which services do we start with? Okay, which ones will come next? Because we can't really start with everything that we want. Our wishes and our resources or our capacity, they must meet somewhere, okay? So I believe from this symposium, you truly advise the government how to start and how to escalate or to roll out these services in a planned phase or in a gradual phase. But I'm also looking at yes, we already have our universal health insurance scheme, which has started, but probably out of this symposium, more ideas could come up. How can this scheme really support these services? So if there are those good ideas, please bring them and we shall accommodate them, because this is not a Quran, this is not a Bible. Okay, it is open to adjustments, open to inputs that are coming from the field. But I'm also looking at how you tell us how we are going to strengthen these collaborations that we have started, okay? Because I know all these partners, international partners, are not here by accident. And it's in our best interest to see how best we can strengthen these collaborations and how we can take them to the next step. And as I said, there must be an accountability mechanism on how the Ministry of Health, in terms of the government, is going to track all the commitments that will be done today. I wouldn't want us to come here next time, I don't know whether here or in any other country, and we have nothing to share from the previous meeting. So there must be a very clear way on how we're going to track all the commitments that will be done in this symposium. So as I finish up my remarks, I just want to tell you that I'm standing here as a very proud Chief Medical Officer on behalf of the government, because this is the first symposium. We have never had another one, so whichever CMO will come, that will be the second one. So I'll maintain my position as the first one to grace the event, on behalf of the government. But also, I want to tell you that this is not just a symposium, but it's an historical event in terms of restoring hope to our people. Some of these conditions to our people, they mean a death penalty. So as we sit here, let us remember that we are not just sitting here in a scientific or in a professional meeting, but there are so many people at our back, behind us, who are looking at us that, the commitments, the deliberations from this meeting, how are they going to touch their lives? How are they going to restore their health? How are they going to restore their hope that they can see tomorrow? So I think that is what should be going in our minds. We should not treat this symposium as any other meeting. No. There are people out there looking at us, like how this symposium is really going to be a game changer in their lives. And as I said, we'll take your recommendations very seriously, and we'll track its implementation. And may God bless all of you who are seated here, but all those who are following online, and all the institutions, including Benjamin Mkapa, as we work tirelessly to make sure that, you know, our people are hopeful for their tomorrow, and that they have a reason to face their tomorrow. Because there are times you really don't find a reason why you should live until tomorrow, yeah? Because you can't see hope in it. But it's us here who are really going to restore that hope in them. It is now my honor to formally and officially declare that this symposium on transplant services and innovative therapies is opened. Have a fruitful meeting, and looking forward to all the deliberations. May God bless you, and I wish you all the best. Thank you for listening.
Makofi tafadhali kwa Dr. Grace Magembe. We may all get seated. Mheshimiwa mgeni rasmi, wakati ukiingia hapa ndani, ziko taasisi na watu ambao wameingia ambao ningependa watambue kama wapo. Hospitali ya Dodoma Referral Hospital, Dr. Benz, nimemwona. Asante sana na timu yake. National Blood Bank Services na timu yetu. Siwezi kufanya upandikizaji wote bila kuwa na damu. Na sisi tunaona the National Organ Bank wao wanaweza kuanza kufikiria kuiendesha. Ndio mlango tunaoutizama going forward, that the national blood transfusion banks that we have could be used as organ banks as we start thinking of diseased donor organ donation. Kwa hiyo makofi tafadhali kwa benki yetu ya damu. Kwa heshima niwaite wawili watatu hapa mbele. I want to call the beneficiaries of transplant services, waliokuwa wagonjwa na wakapata huduma hizi. Tunaye Mr. Masimba na tunaye mama na mtoto ambao walipata huduma ya transplant ya uloto. Wao nisiwaombe tu wasimame, wasogee hapa mbele. Karibuni Mr. Masimba, karibuni hapa mbele. John hapa mbele kabisa. What we are talking is not maigizo. We brought them here purposely so that you know the works of our hands is changing lives. Makofi tafadhali. Wakati tukisubiri mgeni rasmi kuingia, tuliplay documentary za wengine kama hawa walioko katika mikoa yetu, kuanzia Tabora, Shinyanga mpaka tunafika hapa Dodoma, Dar es Salaam, Dodoma hapa makao makuu, na hizo tutazishia kwenye mitandao yetu yote ya kijamii ya hospitali. Asanteni sana kwa kupokea, lakini tuwapigie makofi wataalamu wote waliofanikisha. Mnaweza kurejea kwenye viti. Baadaye tutapata picha pamoja kwenye utaratibu wa picha za pamoja kama kawaida. We are changing lives. Baada ya maneno hayo machache, ni kuombe. Fahamu ratiba yako ni ngumu, lakini tusikilize tu keynote mbili na wawakilishi wa kimataifa. Tuli is heading, may come as I'm introducing you. And she will deliver the remarks on behalf of the College of Surgeons, East, Central, and Southern Africa. Under the EXA, we have 9 colleges, and she is coming from one of the colleges. Thank you very much. The floor is yours as we are setting up your presentation. Kabla hajaanza, nawaambia tu ya kwamba mkutano huu uko live streamed YouTube. Link will be shared, wale ambao wanazo wa share, so that other people can still follow. Your speech was live on our live streams. Thank you very much.
The Honorable Guest of Honor, Dr. Grace Magembe, distinguished representatives from the Ministry of Health Tanzania, esteemed leadership from Benjamin Mkapa Hospital and University of Dodoma, key presenters, invited guests, ladies and gentlemen, good morning. Habari za asubuhi. It's nice to see and meet you all. It's a great honor and privilege to be here today. My name is Edna Herman. I am representing COSEXA CEO, Ms. Stella Itungu, who was not able to be with us today. Congratulations for the 10th anniversary, as well as successful planning and excursion of this very first organ transplant. So as we are waiting for the slides, as Dr. Mugisha said, so we are hosted under East Central and Southern Health Community in Arusha, Tanzania, whereby there are 9 colleges, and COSEXA, which is College of the Surgeons of the East Central and Southern Africa, is hosted. And COSEXA vision is to be the reference surgical body in the region of East, Central, and Southern Africa and beyond. And COSEXA's mission is to promote excellence in surgical care, training, and research. So COSEXA covers and works within 24 countries in Africa, of which there are 15 member countries and 9 partner countries. These member countries are the countries in which COSEXA training and certification is acknowledged and recognized by the Ministry of Health, Ministry of Education, as well as medical councils of these respective countries, as shown there. And COSEXA governance structure consists of the council, and the council is composed of the country representatives from each country of the member countries, of which within the council we have a president, we have a vice president, we have registrar and treasurer who forms the executive or committee, and alongside we have journal of editorial board, of which we have ECA-JS, which is a very prominent upcoming journal for surgery. And underneath executive committee, we have freestanding committees, which are finance and general purpose. We have education and training committee, examination and credentialing committee, research and publication, and then comes chief executive officer. And under chief executive officer, that's where we have the secretariat team, which is hosted in Arusha. And in each country, we have country coordinators who are supporting the country representatives in the respective countries, as well as journal staffs. So we may all agree that there's such a surgical crisis in our region. And in sub-Saharan African countries, the burden of global disease is 24%. And yet only 3 to 4% of the global health workforce is the one that is available. And the government only invests about 1% of the budget into the health workforce, so we can see the shortage there is really vivid. And traditionally, all the trainings have been concentrated in capital cities, and there's been no uniform standard of training across the countries. So we may all know that the shortage of surgeons, surgery has been more termed as a luxury, of which it is a basic need, and we've been lacking behind that. There's always been a problem with brain drain among the region, where the government would invest on getting specialists being trained abroad, and then they wouldn't come back to work. And so there's been as well a big challenge on that. So looking at the regional density, for many years, the density has been at most 1. Up to 2015, it was only Kenya that had 1.21. But of the recent years, this was the study that was done by Lancet, of which at least Namibia managed to come up to 3, followed by Botswana, which is 2.17. And look at us, Tanzania, we are at 0.28. And the recommended density by Lancet is at least 20 surgeons in a population of 100,000. So we still have a long way to go. So COSEXA has been working so hard to address this shortage of specialists, of where COSEXA was established to build a sustainable regional surgical workforce, standardize and harmonize training across the countries, as well as distributing training beyond capital cities, and strengthening quality assurance through regional examinations. So up to now, COSEXA has a total of 153 accredited hospitals across the 15 member countries and 9 partner countries. And looking at these hospitals that we are training in, only 64%, 64% are the only hospitals that are located outside capital cities. So you can see that we are having so many hospitals in semi-urban areas where we're doing training. And with the study that was recently conducted, we were able to achieve over 93% of graduate retention in the region, of which per country the retention rate is up to 88%. So accreditation of the hospitals from our end is valid for 5 years, and after that the hospital is required to apply for reaccreditation, and this is one of our tools for quality assurance. And up to now we have 954 accredited trainers supported through the training of trainers programs that we have. Up to now we are offering 12 specialties. We have general surgery, orthopedics, ENT, pediatric surgery, pediatric orthopedics, urology, neurosurgery, plastic surgery, cardiothoracic, breast surgery, upper GI, and surgical endoscopy. But we still have other curriculums that are under the way, which is colorectal surgery and lower GI, of which you're hoping in near future will start launching and start training. So we do not only depend on the trainings at the hospital, but we are also leveraging on technology, where we have a School of Surgeons, we have a logbook system. This allows us to do thorough monitoring for our trainees before they qualify for graduation. We as well have exchange programs where trainees are able to move from different training sites. We have post-fellowship programs as well as lecture series. So COSEXA is now 26 years old, and since we started the training, we have successfully trained and graduated 1,183 surgeons from various specialists. And over the years, we have also managed to work so hard and to improve, to raise the number of female graduates. So, as I mentioned earlier, COSEXA headquarters is in Arusha, Tanzania, and we have a very strong partnership with TSA, and our currently Tanzania country representatives is Professor Larry Akoko and Dr. Petronila Ngiloi, who are part of the COSEXA Council. And in Tanzania, specifically, we have 12 accredited hospitals. We have trained successfully 16 graduates. We have over 104 trainees currently training within the 12 accredited hospitals, and we have 135 fellows. So Benjamin Mkapa Hospital is our partner. We've been working very closely. The hospital was firstly accredited in 2024, and the accreditation was for MCS, which is our basic course, then general surgery and urologic surgery. And meanwhile, there's a pending accreditation for neurosurgery and orthopedic surgery. And at the moment, we have 7 COSEXA fellows who are as well trainers at the facility, and we have 10 trainees undertaking training in general surgery, urologic surgery, as well as the membership course. So this symposium really triggers our mind, and it's in alignment with COSEXA mission and vision. And obvious the gap is there. At the moment, we do not have a curriculum. There's no curriculum in place for transplant. And obvious, within the region, we do not have any accredited hospital for transplant training and fragmentation care. We as well do not have specialized transplant surgeons to conduct the training. So COSEXA is willing to collaborate. COSEXA is ready for collaboration, and we see a lot of potential for us to collaborate and to fill in this obvious gap. So we can start by identifying those specialist surgeons that are already here within the country. And we have fellowship by election posts that these specialists can apply and join, and then they can come up with curriculum. COSEXA is willing and happy to go through the curriculum, follow the required steps to formalize it, and then we can start training. So this is a picture of 2025 COSEXA graduation that was in Burundi, and we are hoping that next year COSEXA examination and meeting will be held here in Tanzania. Normally we move among member countries, so this is again another opportunity where the whole of COSEXA delegates leadership will be here, so we can start filling in the gap. Thank you so much.
Yeah, asante sana Miss Edna. Napomkaribisha Professor Julie, tunaposeta presentation yake niweze kusema maneno machache. COSEXA kama college, sisi tuna nafasi tayari. Professor Mwashambwa ni accredited COSEXA surgeon, anaweza kuungana na wengine wakaanzisha training kwa ajili ya COSEXA training ambayo inaweza support eneo la transplant, hasa kwenye solid organs ambazo surgeons wengi wanazifanyia. Na pengine hii ni opportunity kwetu sisi kama hospitali kuset up hiyo training, kwa sababu hakuna hiyo training hapa Afrika ambako unaweza kusomea transplant surgery. Kwa hiyo collaborations kama hizi tunaziunga mkono, na asante sana kwa kuja kwa niaba ya mashirika mengine yote ya kimataifa. Allow me now to call Professor Julie Makani. The medicine is so biased, it's male-dominated field, and it has never provided some good names to the good female doctors. It always say father of medicine, father of transplant, father of what. Now I'm bringing to you the proud of who have raised through all the challenges to climb up to the bar and leading not only at MOHAS, but also across the globe. She is a UK ambassador advisor on science and medicine, the ambassador of Tanzania in the UK. While we are setting up, I would like also to say she is the one who has helped a lot of collaborations within our country. She has been mentoring many people, including Professor Abel Makubi when he was training as a hematologist. Makofi tafadhali. One thing ambacho ninajivunia about Professor Julie ni kuwa na moyo wa kutoa. Some of the doctors hawapendi kuona wanafunzi wao wakiwazidi. lakini Julie Makani anafuata mfano wa Bwana Yesu aliyesema mtafanya miujiza hata kunizidi. Profesa Makubi, angalia miujiza anayofanya hapa. Anaongoza hospitali ya Benjamin Mkapa, na leo tuna transplant, tuna collaboration, tunakuza. Something gonna be born out of this symposium that we will all be proud in the coming days because of these two minds. Asante, karibu.
Asanteni sana. Mgeni rasmi, Chief Medical Officer Dr. Grace Magembe, Executive Director of Benjamin Mkapa Hospital, Professor Abel Makubi, DVC RC of University of Dodoma, other distinguished guests, speakers, delegates, ladies and gentlemen, thank you very much for this honor of speaking on behalf of many people who've been working for many, many years. Very, very special thank you and appreciation to our patients and their mothers, because they have been working with us very closely in order to see how we can learn from them and how we can support them. Thank you very much. So, the title of the talk is So the organizers asked me to speak about the bone marrow transplant landscape in Tanzania, but I took the liberty, and I apologize for taking the liberty, of really expanding this so that we talk about advanced therapy. And you've heard from the Chief Medical Officer that specialized and super specialized services are a priority for the government of Tanzania, and they are a priority for us here in Africa. So I will expand the discussion to talk about specifically advanced therapy for sickle cell disease, but this applies to other conditions as well. And very specifically, I will talk about blood transfusion, bone marrow transplant, gene and cell therapy, because these three areas are pillars of the same areas. I'd like to acknowledge individuals, partners, consortium, and most importantly, patients who we have been working together for more than 20 years. So I just wanted to give you a little bit of the context of sickle cell disease. This was the first genetic disease that was described in 1949. This is a disease that is very common. The Chief Medical Officer mentioned this, and others will mention it throughout the course of today. But sickle cell disease is one of the most common genetic disorders. And when you look at the birth prevalence, how many children are born every year with sickle cell disease, the biggest burden, almost 80% of the births are in Africa. When you look at how many people live with sickle cell disease in the world, it's estimated that there are around 8 million people living with sickle cell disease. So in our setting, in Tanzania, in Africa, this is not a rare disease. Outside of Africa, it is a rare disease, and it is classified as a rare disease. We estimate that around 8 million people have sickle cell disease in the world. 6 million of them are in Africa. Sickle cell disease, without treatment, causes a lot of complications and a lot of death. Without diagnosis, without identification, it results in a lot of a high risk of dying. We often have this discussion, should we focus our attention on public health interventions? Because we know by newborn screening, early diagnosis and treatment, and prevention of infection, we can reduce mortality by 70% in the first 3 years of life. And this has been a focus of the public health interventions that have been led by the Ministry of Health here in Tanzania, by WHO, Afro, and others, is that we have to focus on newborn screening, prevention of infections, and access to hydroxyurea, because this will have the biggest impact. However, we do have patients, Nasra, Shani, and many others, who say, we really want to have a cure. And for the past 10 years, we've been having a lot of debates and discussions as to, no, Tanzania should not do or focus on curative therapy. they should focus on public health. And we're very grateful for the leadership at MNH and the leadership at BMH, because they said, we need to start somewhere, and we will start with bone marrow transplant for sickle cell disease in our country. And so what we have been able to do and say over the past 7 years is that we in Tanzania and some other countries in Africa are not just focusing on public health interventions, we're also providing curative interventions such as bone marrow transplant. So our strategy in finding a treatment or finding treatments for sickle cell disease in Africa used an integrated approach. We realized, and I think this symposium is an example, we cannot do it alone. We have to work in an integrated manner. And so we have, we started in 2004, so 22 years ago at Muhimbili University and Muhimbili National Hospital, where we said we have to engage the community. We have to improve healthcare services. We have to do advocacy at different levels. We have to conduct research, and we have to train people. When we started the program, we only had one hematologist who was providing services for the whole country, Dr. Pius Magesa. And we, within MUHA, said we have to train, and I think now we have over 50 specialists and super specialists in hematology and blood transfusion that have been trained. And this is really something, again, as a Tanzanian, really we have been honored because we have been able to be a lead as a country in being able to demonstrate how we can move from sickle cell services in one center at Muhimbili National Hospital to national programs with the coordinator, Dr. Asteria Mpoto, the national coordinator for sickle cell disease, and now we're able to influence and share knowledge across Africa. In 2016, sickle cell disease was included in the National Policy for Non-Communicable Diseases. In 2017, the leadership of SPARKLE Tanzania was led by Professor Emmanuel Balandia, and progress over this period of time. We now work as a coordinating center for Sickle in Africa, which is a consortium that has registered over 40,000 patients with sickle cell disease in 7 countries in Africa. So in terms of finding a cure, in 2017, the first patient was treated with gene therapy for sickle cell disease. And in 2018, the government of Tanzania said we need to find a way of providing transplant for our patients. In 2019, the NIH and the Gates Foundation invested $200 million for gene therapy for sickle and HIV. And as you heard, in 2022, Dr. Stella Malangae, Dr. Fabio Giglio and their partners were able to start transplants for sickle cell. This is really important for us as researchers, but also as providers, because we want to make sure that as we are conducting research, we're also providing services. And we have been able to do that. These are the treatment centers. Really commend Tanzania because you are one of the first countries, 1 out of 3 countries, that have centers of excellence for bone marrow transplant and gene and cell therapy. The other country is Nigeria, and we'll hear about their work that they have done in renal transplant. But the important thing is for us to work together within Africa so that we can share and exchange knowledge. Sorry, some of these are no. So these is just images of some of the centers that provide, I do apologize, provide advanced therapy in Tanzania. So we have BMH Dodoma, as well as MUHAS, MNH, Mloganzila, Aga Khan Hospital. I just wanted to finish by talking about how we move from bone marrow transplant. I think you will know and hear that bone marrow transplant, which is ex vivo, what we call ex vivo therapy, is a complicated process. And what we are hoping to do is that we're working on research where we can have treatment with just an injection, like a vaccine, and that is what we call in vivo gene therapy. And our colleagues here, Dr. Magdalena Limo working in transfusion, Dr. Florence Urio working on cell therapy, and Dr. Siana Nke working on gene therapy are working to make this happen. We have all these partnerships in establishing HLA typing, exchange blood transfusion, advanced therapy, and really the work that's been led by Dr. Daima Bukini on looking at how we can engage patients and understand the ethical issues around that. So we started the Advanced Therapy Program 5 years ago, and we have been able to identify 200 patients, children and adults, who require transplant as well as gene therapy. The blood transfusion services, we're hoping, and I'm really glad that the partners from NBTS are here. We need to strengthen blood transfusion service. We're working with Neema and her colleagues and Arafa from the Bone and Blood Foundation. And the aim is really to set up a registry for hematopoietic stem cells or blood stem cells, so that instead of having to look for stem cell donors from South Africa or from elsewhere, we can provide them right here in Tanzania. We also have been working at national level, and really just to commend this first organ transplant symposium by BMH. We're working with partners in South Africa with the BMT classroom, and we are also working with the Africa Bone Marrow Transplant Society. So this is work in terms of the Global Gene Therapy Initiative that I mentioned earlier, and this is work published by Dr. Doxen and Dr. Daima and others, is really highlighting, highlighting that South Africa, Tanzania, Uganda in Africa are really taking the lead in looking for gene and cell therapy for sickle cell, HIV, and hemophilia. South Africa leading the work on in vivo therapy for hemophilia, Uganda leading the work for curative therapy for HIV, and we in Tanzania are looking for leading the work on gene therapy. The importance of partnerships, people, partnerships, and professional development, and really looking for partners such as Tabiri. This is Tanzania Biomedical Research and Innovation, which is establishing centers so that we can have an umbrella and bring together all these initiatives, including two things that I want to mention: science diplomacy for policy, as well as local production for access to health commodities. Ultimately, we really need to remember that we conduct research, or we do science, not for science or for publications, but really for the benefit of the community and for humanity. And really to urge you all, in order for you to work in this space, please think about having a relationship with people who are affected by the disease. Thank you very much for all the people who've been working for many years on this condition, and thank you very much for listening to me.
A round of applause. Thank you very much. We are very delighted to be the daughter of the soil, doing great things, leading change, advancing care, and we are very ready to receive some of the new advancement that you are working on your research, and the collaboration that you are setting us up between UK and Tanzania, so that we can have the first class type of services in our place. I hereby now call the last keynote speaker for this morning, who is none other than Professor Masumbuko Yatembela Mwashambwa, a renowned academician from University of Dodoma, working in all teaching hospitals that UDOM uses, including the Benjamin Mkapa Hospital. He's the first transplant surgeon to be trained by the Tokushukai BMH UDOM collaboration, and he has been leading. He knows a little of Japan. He can say a word of Japan.
Executive Director of Benjamin Mkapa Hospital, and Professor Lazaki, Deputy Vice Chancellor, ARC, we call it ARC in the universities. Keynote speaker, I was happy to meet Professor Makani. She's here, and all other delegates. Good morning. I am going to speak a little bit on transplant landscape. I am sure the word landscape comes from Mugisha, because I know how he thinks. Okay, so we have done transplant, started transplant in Tanzania. One of the things that I would like to say here is that the only time we celebrate to see urine is after successful kidney transplant. So most of the time when you go to the toilet, we don't celebrate to see urine, and we think that is okay. But I can assure you, the team, the transplant team in theater, they would usually celebrate to see urine. So don't wish to lose your urine, because this is not a very good idea. Okay, so the introduction on CKD. I am sure the physicians and nephrologists are going to talk a little bit more in details on CKD. The CKD is the failure, irreversible failure of function of the kidney. And in defining the CKD, two parameters are used. One is the amount of urine, the amount of albumin in the urine, and then the second one is the estimated glomerular filtration rate. Both of them are used concurrently to assess whether a person has CKD or not. So as a general message here, I would like to recommend that, especially those people who are above 40, 50, to make sure that you assess the amount of urine, the amount of albumin in your urine, because it could be the earliest time you can pick up chronic kidney disease. And then number two, second message is that for those who have hypertension or have diabetes, okay, and as I said earlier, who are aged, I think it is important to check up and see if you could pick CKD quite early. In patients who have diabetes mellitus and hypertension, the risk of having CKD is even higher. Actually, up to 40+% of these people will be having CKD. And then to just tell you the burden of CKD, 10% of the global population. In other words, 850 million people, approximately 1 billion have CKD, okay, in the various stages that I showed you in the first slide. In other words, you can fit 12 Tanzanian population to get the number of cases of CKD worldwide, okay? More importantly is that the CKD is double to number of cases of diabetes mellitus, and it is 20 times the number of cases of cancer and HIV and HIV/AIDS, and it is twice as much as the cases of tuberculosis. Now you know the emphasis, the global emphasis on management of these major burdens, okay? So all of them are outpaced by the number of CKD. And actually, after every 20 seconds, somebody is dying of chronic kidney disease, highlighting the need to take intervention. Okay? And the global prevalence varies from country to country. Okay? In this ISN atlas, Africa seems to have lower prevalence of around 4.19%, but actually some other studies have indicated that the prevalence could be between 10 to 15%. And even in Tanzania, the prevalence is estimated by this study that I've shown here to be between 7 to 15%. In other words, here about 10% of us have some form of CKD, and that is why I said we should start screening quite early. And in terms of death and mortalities, okay, CKD contributes 10%. And actually, if you look at the recent data, it is even going to 9% of causes of death. So about 1.5. Okay, if you look at this figure here, CKD is number 9, and it causes death of 1.52 million people worldwide. So CKD is a significant cause of morbidity. Even spending is quite high. It is estimated globally, the median health spending is 353 per capita globally, okay? And the government uses about $216 per each person spending on health. And those who take money and treat themselves would use about $92. As you can see, this is more than what we earn per person. Now, for you to come back to the normalcy of kidney function, there are 3 approaches that are used, which I think most of you guys know. The first one is the dialysis that we do to our patients. And according to the Ministry of Health data, we have 300 and 400 people who are on hemodialysis currently, okay? And I am not disputing what Madam Chief Medical Officer said. We are approaching 200 cases of transplant, which is the second mode of treatment. And of course, we sometimes, in some patients, conservative management can be one of the approach. So, and the country, Tanzania, is in the global map in the treatment of CKD, both in terms of hemodialysis. We are also on the map on a kidney transplant, okay? And the other conservative, as you can know, everybody can do. And it once used to be the mainstay of treatment before we started hemodialysis in 2009. Now, the transplant in Tanzania is a success story, as we can say. And the Chief Medical Officer highlighted earlier that the transplant began in 2017, and the Muhimbili National Hospital was the first one to begin transplant services, kidney transplant services. And then a year later, the transplant services were initiated at Benjamin Mkapa Hospital. And actually start or do the first kidney transplant, thanks to the local collaboration. Now, our sister hospital, MNH, which had collaborated with University of Dodoma, BMH, collaboration with Tokushikai Medical Group, which enables us to do first kidney transplant in 2018. And we are doing the local partnership with our friends and colleagues at BMC, and we successfully did the first kidney transplant last month, and the patient has been discharged. Okay. It is also important to mention that we have been partnering with Lancet Metropolis Lab in accessing HLA typing for our cases. Now, the cost of transplant, I think this may not be very important, and maybe the nephrologist would come with a better figure. Okay, now, transplant teams. I think it is important to highlight the transplant teams that we have. And these are rough figures. It could be more, as you know, transplant is a multidisciplinary, and it's not a one-man show. So at BMH, we have at least 6 surgeons. MNH, they confirmed they have around 6 surgeons. And BMC, we have trained at least 4, and some more have shown interest to join the team. And the number of nephrologists in the entire country, I think, is still low, but those who are involved in the transplant are shown in this table. The transplant coordinators are also quite important. You must have a central point of coordination because the kidney transplant requires that every aspect of the patient is addressed. The number of cases that we have done, MNH, Upanga, they have done 90 plus, and the Mloganzila 20. Okay, so that gives you the total number of cases that we have done. And the lower part here tells about the BMOH experience, where we have at least 2 cases of recorded rejections, and one of the patients actually died following rejection. But sincerely speaking, we have lost at least 4 grafts because of thrombotic events, and one patient died. Minutes, then the patient died before she could see the next day. And the causes of mortality are as shown on the this part of the slide. We have also lost patients because having a kidney transplant does not exclude you from dying from other common causes. To a demise or at home, others had COVID, just like any other general population. Okay, so achievement support. The government of Tanzania have supported the hospitals that have done transplant quite tremendously. The amount of investment that the government has done has enabled or created a favorable environment for us to do our academic or clinical work with no significant hurdles. And then number 2, I want to underscore the Madam President support special fund that was brought to the hospitals to assist people who were unable to pay for transplant. I think that is also very important. The organ donation and transplant legislature, I think it is under the final preparations, and maybe in a very near future, we're going to be able to do deceased donor transplants, which I think is going to be change tremendously in the way we handle CKD in the country. And of course, other organs transplant would be possible. Okay, the CMO spoke about the role of universal health insurance, and I'm sure the NHF are also here going to speak something on that. And the partnership is very important. Okay, the BRK hospital in India, Tokushikai Medical Group in Japan, they have helped us and actually pushed that quite significantly to ensure that we start a kidney transplant quite early. Multidisciplinary teams that we've created within our hospitals are very important. Okay? Again, transplant is not a one-man show. There's no single person who can do kidney transplant alone. You must have a good team and that has high spirits. And at times, kidney transplant may not be cost effective if you are to see how much one may earn from kidney transplant. Advocacy and the leadership is very, very important. Okay, had it not been the executive directors pushing us to begin, maybe things would have been quite different. Okay, so key challenges, there are many. We have surgical related challenges, okay, especially sometimes, and it appears maybe once or twice in a year, the donors wouldn't be available, even with the maximum advocacy. Okay? And then number two, which I think we must also address and we have begun actually to address, is reliance on open donor nephrectomy. I think the scars that we create are quite big, and that might discourage donors. Pharmaceuticals, especially on the costs of immunosuppressants. I'm sure the key stakeholders will speak on that. Lab, as I said earlier, I think it is important that in our country, we may invest in one of the lab, in one of the hospital, and then make it the main hospital for HRA typing, CDC, and those kind of things, okay, so that the other hospitals can access such services, okay, through collaboration, okay. Cost of transplant, they're still high, not as high as it was when we were sending patients abroad, but I think we have reduced quite significantly. Okay, so these challenges that we have discussed here actually are similar across Africa, as it was reported in this paper. So we have opportunities. One, we have a large number of patients that we need to attend. Okay, if you take 3,400 patients who are on hemodialysis as we speak, and then you say, I am going to operate all of them, okay, you would require to operate 9 patients each day, okay, for the 361 days. And if you say, we are going to exclude Sundays, then you will have to operate 13 people every day, okay, from Monday to Friday, okay. And if you say, I have 2 operating days, you would require to operate 32 people across the centers. What does this mean? We need to pull out our socks and make sure that we have more transplant centers as we can. And then the outcomes, they are quite encouraging, not very bad for beginners. Okay, so we think the outcomes are encouraging, and we have young population, of course, that makes quite flexible in kidney transplant. At BMH, we have limited to operating people, transplanting people under 60, but I think that is not a very significant risk. We must start going above 60. In Japan, they would operate somebody who's 90 with a kidney transplant, and they have no worry about the outcomes. Okay, our families are extended, which means a potential pool for donor, and we have capable hospitals. And I would like to also encourage our colleagues, especially those big hospitals like Aga Khan, Mbeya Zonal Referral Hospital, and of the like, to even start considering kidney transplant. Because we have already started, it would be possible to create a teams in the hospitals. The role of universities was highlighted, Professor Razaki, and I'm not going to repeat. Okay, we need to continue training to our people, okay, especially, as I said, one of the key challenges is open surgeries. Maybe donor nephrectomy would be the best, but when we start deceased donor, things will be even easier. In the hospital that I've trained in Japan, my professor has started doing transplant using a robot, okay? We may also work towards using robots in our center as we strive to be a center of excellency. Okay, summary, significant progress that we have made in the past 7-8 years. We have done quite significantly, and we have a significant number of patients who are waiting for us, so we need to start running even at a higher pace, considering the quality. I understand BMH, UDOM are going to start construction of a kidney and organ transplant center. That should be one of the way to run fast, okay? And we need to strengthen through training, cost reduction, advocacy on organ donation, and we should actually start very early, because even with deceased donor, you must obtain a consent. And you guys know a person who is dead in a family is still a family member until that person is buried. And sometimes we keep our deceased our family members up to 1 month while planning for a good burial. So, which means if we are going to take an organ, we must start preparing ourselves very, very early in advocacy. Okay, transplant center, I have spoken. So, with that, thank you very much. This picture was taken that was there to assist the kidney transplant. Okay, some people look quite prominent. I have no idea who are they. Some of them are here. Okay, and this was the theater environment. Remember, for where 2 or 3 gather in my name, there I am with them. Okay, that's also a saying by Jesus to his apostles. Thank you very much.
Makofi tafadhali. Yeah. In God we trust, but in everything else bring evidence. In God we trust, but in everything else, please bring an evidence. And thank you, Professor Mashambwa, for bringing the evidence of how knowledge has transferred from area of high concentration of knowledge, that was Japan, came to Benjamin Mkapa and now is flowing up to other parts of the world, of the country and other parts of the world. We are coming to the end of our session, morning session, but allow me to give 1 minute remarks for Mr. Masimba, who is a beneficiary of kidney transplant after Mwashambo has said to give a word for 1 minute, and then we'll hear from the other person who is with us who benefited from bone marrow, and then we'll go to photo shooting, breakfast, and then come back for another session. Makofi tafadhali kwa ratiba mpaka sasa. Mr. Masimba, karibu.
Jamhuri ya Muungano wa Tanzania. Jamhuri ya Muungano wa Tanzania. Mheshimiwa mgeni rasmi, mimi naitwa Richard Masimba, ni mnufaika wa upandikizaji wa figo. Na miezi 5 tu toka nimepandikizwa figo. Kwanza natoa shukrani zangu za dhati kwa serikali ya Jamhuri ya Muungano wa Tanzania. Naomba tumpe maua yake Dr. Samia Suluhu Hassan kwa kuona jambo hili ni la muhimu sana. Lakini pia nishukuru Wizara ya Afya kwa ajili ya kuona jambo hili Watanzania waweze kupata tabasamu. Shukrani za pekee nizipeleke kwa madaktari wa Benjamin Hospitali. Kwa kweli nimewanyanyulia mikono. Nilipata shida hii, mimi nimekuwa nafanya dialysis miaka 3 mfululizo. Katika miaka 3, mara 3 kwa wiki, masaa 4 kitandani. Lakini ilipofika tarehe 16 mwezi wa 12 mwaka 2025, niliamua kufanya upandikizaji wa figo. Na ni kijana wangu alisema, baba, naomba nikupe zawadi kwa kunilea, kwa kunisomesha. Sina cha kukupa, naomba nikupatie figo yangu moja. Kwa kweli tulifanya upandikizaji salama na madaktari wa Benjamin Mkapa. Kwa kweli nilifarijika sana. Nilipokuwa nimelala niliona watu wamezunguka wengi. Na kiongozi mmoja tu alikuwa anauliza, uko tayari? Wewe uko tayari? Alifanya tunaanza. Baada ya hapo sikujitambua mpaka niliporudi kule CCU, asubuhi nakuta dumu limejaa mkojo. Nilishangaa sana, kitu ambacho nikikosa kwa miaka miwili. Niliambiwa nitoe sample kwa ajili ya kupima tu, kuangalia kama kuna infection ya mkojo. Siku 4 mkojo wa sample nilikosa. Oneni miujiza iliyofanyika ya sayansi. Katika siku moja tu, masaa machache, nilikuta kuna dumu la mkojo. Kwa hiyo naweza kuamini kwamba sayansi ni kitu kingine. Tumshukuru sana Mwenyezi Mungu. Kwa hiyo shukrani zangu nazielekeza katika maeneo hayo, na naomba sana Watanzania wenzangu wajue kabisa swala la upandikaji wa figo linawezekana na tabasamu itarudi. Kwa mtu ambaye aliniona miezi 6 iliyopita na mtu ambaye ameniona juzi, ameshangaa sana. Asema sio wewe ukuwa unaumwa, labda ulisafiri. Kwa kweli afya yangu imerejea na limeleta tabasamu katika familia na Watanzania wenzangu, na nimerejea kazini. Sasa nafanya kazi zangu kwa uhakika sana.
Makofi tafadhali.
Sina changamoto yoyote, niko vizuri, naendelea na kazi zangu na kufuata masharti ambayo wataalamu wamenipa. Rai yangu tunapokuwa tuko hapa, tukitoka hapa basi tutoke na suluhisho kwamba katika hili swala la upandikizaji wa viungo tunaweza kufanya nini ili Watanzania wenzetu waweze kuwa na tabasamu. Wako wengi sana wanapata tabu, na mimi nimekuwa ni shuhuda kwa sababu nimeyaishi hayo. Kwa miaka 3 nikifanya dialysis, kuna wengine walikuwa natuaga kabisa, wasema bana, mimi nimeshindwa gharama. Kwa hiyo ukiona siji ujue ndo basi. Baadaye mnaambiwa tu bana, mwenzetu ametangulia mbele za haki. Lakini tulisema haya ni maisha, na tuliendelea, na wengine waliweza kusaidiwa na waliendelea na maisha. Kwa hiyo niwaambie Watanzania wenzangu kwamba tusikate tamaa. Hii inawezekana, ila tu tuendelee kumtegemea Mwenyezi Mungu.
Asante sana.
Basi baada ya kusema hayo, mimi niwashukuru wote na niwashukuru kwa mwaliko huu, na mimi kwa kweli nimefurahi sana kuwa katika mmoja wa watu ambao wamekuja kwenye mkutano huu wa kwanza. Kwa hiyo nitakuwa balozi mzuri sana wa kueleza yale ambayo tumeyaishi tukiwa na shida ya changamoto ya figo. Asanteni sana.
Asante sana. Kwa namna ya pekee ile timu ya upasuaji, naomba niwasimamishe wauguzi tu walioko humu ndani walioshiriki kwenye operation yake na operations zingine. Niwatambue wakiongozwa na mkurugenzi wao wa wauguzi Benjamin Mkapa, Sister Mwanaidi Makao. Hii ndio timu ya wauguzi waliochagiza huduma kama hizi. Ukiona vyaelea vimeundwa, uwekezaji uliofanywa kwa watu wetu kufikia uwezo huu, tunasema asante sana serikali, tunasema asante sana watu wote walioshiriki. Nimlete Mama Shani na Shani mwenyewe, nimlete Shani na mtoto wake ambao nao walinufaika kupata huduma za upandikizaji uloto katika hospitali ya Benjamin Mkapa. We make a difference. 10 years of our existence in the nation, we have a testimony to tell the world that Tanzania is growing.
Honorable government officials, Benjamin Mkapa Hospital Management Team, respected doctors, healthcare workers, distinguished guests, our media representative, habari za asubuhi. Today I stand before you not just as a speaker, but as a grateful parent whose child has been given a second chance life. On behalf of all the post-BMT parents, we would like to express our deepest and most sincerely grateful to the government of Tanzania under the leadership of Madam President Samia Suluhu Hassan, in collaboration with the government of Italy, for the valued support and partnership. Your commitment, cooperation have made a meaningful impact, and we have truly appreciate your continued effort to make bone marrow transplant services accessible to our children. Your commitment to improving healthcare has brought hope where we was once fear and uncertainty. You have not just supported a medical program, you have saved family lives, dreams, and futures. To the doctors, specialists, and medical teams, words are not enough to thank you. Your knowledge, dedication, and compassion have carried our children through one of the most difficult journeys of their lives. You have worked tirelessly, often beyond your limit, to ensure their recovery. To us, you are more than professional. You are our heroes. We also extend our appreciation to the nurses and supportive staff, whose kindness, patience, and constant care made our world of difference during long, challenging days in the hospital. Your smile, encouragement, and gentle hands gave us strength when we need it most. This journey has not been easy. There were moments of fear, uncertainty, and pain, but through it all, your support gave us hope and courage. Today, seeing our children recovering and smiling again is the greatest gift we could ever receive. As a parent, we carry immense gratitude in our hearts. We thank you for giving our children not just treatment, but future one filled with possibilities, dreams, and lives. Through my doctors to be here. May this program continue to grow and even more children in need, so that no family must lose hope due to lack of access to care. Once again, we thank the government of Tanzania under the leadership of Dr. Samia Suluhu Hassan, the collaboration of the BMH and MNH team under Professor Julie Makani and Professor Abel Makubi. For us, you are not just professors. We are really proud to announce that currently we recognize you as a grandpa and grandma for our kids. The BMT doctors and everyone who made this possible, may God bless you all. Asanteni sana.
Asante sana. Sasa tusikilize mjukuu akimwambia babu. Akimwambia na bibi yake pale. Dakika moja, sema neno lolote. Mama amesema, lakini wewe sema neno lolote. Hapa kuna babu yako na bibi yako wako hapa.
Good morning everyone. My name is Nasra and I was one of the patients of Benjamin William Mkapa. Since I was born, I was diagnosed with sickle cell disease. I was sick, always admitted at the hospital, losing too much school, and many painful moments in my life. I thank you, BMH staff and doctors, for recovering me, and thank you to all of the professors of Benjamin Mkapa. Asante sana.
Makofi tafadhali. Asante sana. You can second hapo. Babu na bibi, njoni mpate picha. Babu na bibi, njoni mpate picha, alafu Mr. Masimba na wewe utakuja. Yeah. Na hapa tutaanza zoezi la picha. Karibu tupite tupate picha pamoja. niwapandishe hapa juu ili tupate picha nzuri. Babu na bibi mtakuwa sehemu. Dr. tupande hapa juu kabisa, tunaanza zoezi la picha. Yes. Masimba anapanda na yeye sasa hivi, tupande juu. Anakuja. Naomba tupande juu jukwani. Ni juu jukwani. Mr. Masimba karibu. Babu na bibi msikosekane. Yeah. Hapa ni wewe unaketi afu wanasimama nyuma yenu. Yeah. Yeah. Na hapa tutakuwa tunaanza zoezi la official photos. Yeah. Our photographers. Sawa. Masimba. Ngoja nianze hii picha kwanza. Professor Julie, usimame hapa na watu wengine wote. Bibi ndio aje hapa. Sawa, bibi umesema uje hapa. Alafu mganga mkuu anasema mimi kwa kweli natoa nafasi kwa bibi kwanza. Bibi, tunashukuru sana. Thank you very much. A round of applause. Picha inayofuata, ninaomba hematologist wote wanaoshughulika na BMT kokote kule Tanzania, njooni nyuma ya picha hii. Msitoke, mbaki mpaka hii picha hii ikamilike. Hematologist wote walioko hapa, young and old, men and female, from MNH, from MUHAS, from Benjamin Mkapa, from UDOM, from KSMC, from Bugando. Please occupy the stage. Occupy the stage, left and right. Yes, even from Globe. Hata wale walioko online tunapata picha ya pamoja kwa online. Watakuja, wao wana picha yao mahususi kabisa. Aya, smile kwenda mbele, sickle cell imeisha. Kamera unaotazama ni ile pale. Baada ya hawa watatokea upande huu, watakuja transplant surgeons wote waliopandikiza figo, transplant nephrologist wote, nurses walioko hapa, anesthesiologist walioko hapa. Msogee tafadhali. Mheshimiwa mgeni rasmi, wakati ukiendelea kufuatilia, aliingia mwakilishi wa mwanasheria mkuu wa serikali, Mr. Kanani, tafadhali simama. Ofisi yao tuliwaalika mahususi kwa sababu wanahusika na uandishi wa sheria na mambo mbalimbali. Kwa hiyo yeye anatoka kitengo cha uandishi wa sheria, ofisi ya mwanasheria mkuu wa serikali. CPD. Yes, kutoka CPD. Haya, wengine huku. If you are transplanting, come close. Wafupi kama kawaida ni mbele. Sogea kushoto kwako, wenzako watokeleze. Warefu kama Dr. Ture wanakaa pale nyuma, safi. Sogea kidogo, sogea. Makofi tafadhali. Makofi tena. Haya, niwaombe mchukue nafasi, niwalete wakurugenzi, wawakilishi wa taasisi mbalimbali zilizoko hapa kutoka kwenye hospitali Muhimbili, kutoka hospitali za kanda za mikoa, kutoka hospitali za rufaa za kanda na rufaa za mikoa, walioko wote hapa. Wawakilishi kutoka NHIF, kutoka MSD, kutoka Blood Transfusion Bank, tafadhali occupy the stage. Pita upande wa kulia wa stage hii, njoo upande wa kushoto ndiko mtakakotokea. Wawakilishi kutoka taasisi CPD, na wewe unatakiwa huku juu, kutoka MNH wakiongozwa na Dr. Faraja, kutoka NIMRI, kutoka NHIF, Dr. Edith, kutoka taasisi ya utafiti NIMRI, Dr. Enid na wenzako. Nashukuru sana. Tutafanya kwa makundi mawili kama tumekwisha kujaa. Hii ni picha muhimu sana na lazima tuiweke kwenye kumbukumbu. Tutafanya kwa makundi mawili. Sogea kulia, sogea kushoto, sogea kushoto kidogo. One. Aha, vizuri kabisa. Smile, sickle cell transplant na taasisi zetu zote kwa ujumla, mambo safi. Picha ya kwanza ya makundi kutoka taasisi mbalimbali. Jamani, asanteni sana kwa kuja. Asanteni sana kwa kuwa pamoja nasi tunapoandika historia hii. Kundi la pili tafadhali. Naona tunatokea upande ule kule. Tunatokea upande ule kule. Kundi la pili, wawakilishi wengine kutoka wizara walioko hapa ambao bado hawajapata nafasi ya picha. Sogea kwenye balance, andaa tabasamu. Nikisema tabasamu linaenda hewani moja kwa moja. Ehe. 1, 2, 3. Ya, tunaomba picha muhimu. Picha muhimu sana. Asanteni kwa kuja. Niombe watu wetu waliotudhamini, taasisi ya UDOM, taasisi ya ENCO, kutoka kule Fahari Motors, sponsors wetu wote walioko hapa, tafadhali njoni haraka sponsors wetu. Ninakwenda haraka ku catch up na time. Kwa niaba ya UDOM naona anakuja Shakilu, Fahari Motors. Sponsors wetu Enco Pharmacy, Fahari Motors, sogea kule wengine, sogea that side, pita upande ule kule. Asanteni kwa support yenu, asanteni kwa kuwa stakeholders wa huduma hizi. Pamoja na Domia, mwakilishi kutoka Domia Estate ambapo tumefanya mkutano huu. Yuko kutoka Domia. Anatafutwa kutoka Domia. Kama yupo, ataingia kwenye kundi linalofuata kama bado hajaweza kufika. Asanteni sana kwa kuja. Asanteni sana kwa kutusupport. Anakuja, basi subirieni wale sponsors, subirieni sponsors mwenzenu ambaye amesababisha nyie sponsor muonekane. Yes. Catherine Mwimbe. Huyu ni miongoni mwa founders wa hospitali ya Benjamin Mkapa. Anayo story atatuambia baadaye, wakati serikali na set up wao walikuwa wajumbe wa kamati ya kwanza ya mkoa, wakiwepo na mzee wetu Jordan Rugimbana aliyekuwa mkuu wa mkoa wakati huo. Asanteni sana kwa support yenu. Makofi tafadhali. Niombe international delegates wote tuliopo hapa. All international delegates who are here, kindly proceed to the stage for a photo with the survivors and the delegations from the Ministry of Health. International delegates, you are international delegates. Yes, Dr. Babu, you are welcome. Babu in Tanzania is muzee. Oh, a grandfather. Yeah, karibu sana. Our international delegates who are within the whole, all the way from Apollo, India, from Uganda, from Nigeria, from Italy. Yeah, because you are, yes. Makofi tafadhali. Kabla hamjaondoka, stay there. All speakers who have been assigned to speak today, kindly proceed to the stage for a group photo. All speakers, all the way from NIMRI, UDOM speakers, NHIF speakers, occupy the stage. Occupy the stage, please. We honor your commitment. Wengine mwende side ile. Make sure you are visible. Wafupi wapeni nafasi wasimame mbele. Go to the other side, I think. You'll be blocked. Pass behind or squeeze. Sogea mbele, Dr. Helen, Sogea mbele kabisa. Baja huyo akae mbele yako ili aonekane, alafu ukae nyuma yake. These are all speakers They will enrich our discussions. Thank you very much. Asanteni sana. Tunatokea upande ule kule. Now I call upon BMH directors, assistant directors who are here for a group photo. Benjamin Mkapa, while committee mjiandae, kamati ya maandalizi mjiandae. Ushers pia mjiandae. BMH assistant directors walioko hapa. Kundi la kwanza BMH, naweza kasogea. Yes. Wonderful. Thank you. Okay, smile. Tabasamu. Okay, then the second group goes. Natokea upande ule kule. The second group joins the team. Protocol ushers, get ready. Kamati ifuate hapa. You come this side, wanakamati wote. Yeah, protocols, quickly. Kamati ya maandalizi. This is history. The photos will live forever as long as we upload them on the online platform. And they will tell that this day in particular, May 6, at Domea Estate, a symposium, the first symposium on organ transplant was done. Protocols, tupande. Kamati, twende. Asante protocols, mnaweza kuchukua nafasi. Kamati, makundi mawili. Au tutaweza kuingia wote? Dr. Shija, tutaingia wote, si ndio? Kwa kuwa mwishoni mwa wiki hii kutakuwa na annual general meeting ya wauguzi itakayofanyika kule Arusha. Tunatamani picha ya wauguzi ambayo itapresentiwa kule tuipige hapa. Sawa ambao mtaenda nayo kule, mnaweka kwenye mnaweka kwenye basi mkiwa mnasafiri. Ile picha mtakayobeba tunataka ipigwe hapa. Kwa hiyo nitapiga makundi mawili. Kwanza la wauguzi wa transplant, alafu wauguzi wa hematology, alafu wauguzi wote. Sawa jamani? Kwa kuwa hii picha ni mimi mwenyekiti wa kamati na mtaalamu wa mawasiliano Jeremia Mbwambo, ni lazima tuwepo. Kwa hiyo tunachukua nafasi. Microphone off. Thank you very much. Smile on. Asante sana kamati kwa usimamizi wenu, mtatokea kule. Niwaite sasa wauguzi wa hematology, wauguzi wa bone marrow transplant walioko hapa, kundi la kwanza. Waite wote. Walitaka waende na hayo makundi mawili kwa sababu ndo specialty tunazopeleka kule kwenye mkutano. Niwaite wote. Sawa. Wauguzi kutoka transplant na mkurugenzi wetu wa wauguzi, pandeni hapa stagini. Asante wauguzi. Zoezi linalofuata ni kupata picha ya meza kuu na kukabidhi zawadi kwa mgeni rasmi na meza kuu. Kwa hiyo bibi naweza nikamruhusu ashuke na mjukuu wake. Alafu Masimba, hujapata babu, hujapata bibi, si ndio? Meza kuu, mketi kwenye viti. Wakati zawadi kwa mgeni rasmi zinaandaliwa ambazo zitakabidhiwa na Profesa Ebo Makubi, Mheshimiwa mgeni rasmi, nataka nikujulishe tulikuwa na wanafunzi, tunao wanafunzi hapa ndani wanaosomea hematolojia, the future of our transplant services, na resident wengine wote walioko hapa. Nitawapatia upendeleo kama wajukuu wajao au babu wajao na bibi wajao. Okay, niombe mpande haraka haraka resident trainees wote kutoka hematology, kutoka MUHAS, resident kutoka UDOM ambao mko hapa, quickly kimbia, ingilieni huko tu. Hawa tuliwapa complimentary pass. Hawakulipia, walitakiwa kujisajili tu na kufika Dodoma, na sisi tunawahudumia kwa kila kitu. Lengo ni kwamba waone walikotoka watu miaka 10 iliyoko, waione leo na kisha watutengenezee future. The future of transplant services in Tanzania is in your hands. Don't supplement, pass, and take over the mantle from your seniors. Asanteni sana na kila laheri. Sasa nikusimamishe ili upokee zawadi na wengine wapokee zawadi ya Benjamin Mkapa kwa kuja hapa. Wewe mgeni rasmi, tafadhali tusimame, tutapokelea hapo hapo. Profesa Makubi ameandaa zawadi maalum kwa wageni wote waliokuwa wageni rasmi. Tunasogeza viti nyuma na baada ya hapo tutakuwa tunashuka kwenye stage. Profesa Makubi anapokea zawadi ya kwanza atakayomkabidhi Dr. Grace Magembe kama ishara ya shukrani. Ana vikao vya kamati ya bunge, ana madaktari wote nchini, ana huduma, ana hospitali, lakini ametenga muda wake hapa kuja. Naomba sote tumpigie makofi anapopokea zawadi ya kwanza. Mpatie Profesa Makubi zawadi ya kwanza. Makofi tena. Atakayepokea zawadi wa pili ni mwakilishi wa DCS, Dr. Juliet Kabengula. Watatu atakayepokea zawadi hii si mwingine bali ni Dr. Ruta RMO wetu. Huyu ni kiongozi wetu wa afya hapa mkoani. Mambo kama haya hayawezi kutokea bila yeye kuwa anafahamu. Tunasema asante sana. Na wa mwisho, lakini si mwisho kwa umuhimu kupokea zawadi hii, ni Profesa Razak kwa niaba ya Chuo Kikuu cha Dodoma. Kwanza amejipa kwa sababu ni mshiriki. UDOM ni identical twin of the healthcare services that are available on top of the hill kule juu. Baada ya maneno hayo, ninaomba moja na naomba ukabidhi zawadi moja ya mwisho tu kwa international delegate kutoka COSEXA, Dr. Edna ambaye atakuja, alafu nitakupatia microphone. Nipatie moja. Pita hapo. Kwa niaba ya wageni wote waliotuwakilisha kutoka taasisi za kimataifa ambazo ziko nchini Tanzania, mtamkabidhi zawadi yake hapo. Profesa Makubi, kabidhi zawadi. Asanteni sana, nampatia microphone ya.
Well, even when you're invited as a guest of honor, but if you're one of them, you feel very free. I'm sure if it was a minister, he wouldn't have done what I'm going to do. So when I was invited as the guest of honor. And there were no restrictions that were given to me as to what I could declare or inaugurate or launch. And for that matter, in my capacity, I want to take this opportunity to declare Professor Makubi and Professor Julie as official Babu and Bibi.
Asante sana CMO, official Babu and Bibi.
Official grannies. So my daughter, be rest assured that you have official babu and bibi, official grannies. Thank you very, that's kids. There will always be kids. Thank you.
Thank you very much.
So that will also go in the proceedings of the meeting, that they are official babu and bibi, in the proceedings of the meeting. Thank you.
Asante sana. Shika microphone. Asante sana CMO kwa kututangazia rasmi babu wa taifa na bibi wa taifa. The rest remain seated as our esteemed delegations walk out. And then we'll go for breakfast. You are free to continue with your timetable as you wish. I understand there will be a media interview at the booth. Kindly proceed. Waandishi wa habari, jiandaeni pale kwenye booth kwa ajili ya... Can you stand up anapotoka? Studio, tuandalie zile dokumentari zetu na... Baada hapo tutakuwa na very short tea break and then we'll kickstart some of the other timetable. Our first speaker will be Dr. Ebun Bamgoe right after breakfast. Remain seated, you will be directed for tea. You can chat sideways, backward, forward, as they make you able to go to have your morning tea. Asanteni sana kwa ushirikiano wenu kwa session ya kwanza. Mungu ibariki Tanzania, Mungu ibariki First Organ Transplant Symposium mpaka tutakapokamilisha jioni saa 10. Asante sana.